their reaction to how you approach them, their reaction to how you touch them, what they feel when you're touching them, I think should be one of the big drivers of our therapeutic relationships versus here's what's best for you, patient. You don't know what I know. It's about tempering our egos back down and say, you know what? Here's what I feel. Here's what I think. Here's what I found. What do you feel, right? Do you feel what I'm doing right now is relevant, important, familiar? Does it feel like it might be useful, or are we wasting our time, or do you feel like I might harm you, right? We all are taught, most of us are taught in our manual therapy training, a certain level of pressure is being correct, right? If you're learning craniosacral therapy, that super light pressure is not only best, but it's the most you want to do. So you do certain things. If you're doing deep tissue, it's like the other end of the spectrum. Can both of those accurately just pinpoint one tissue, or are you really just sort of honing in on a person's preference? Because I can guarantee you, if you're looking for deep tissue, you're going to leave that craniosacral therapist after a session, no matter how well of a seller they are, and vice versa for the deep tissue work, if you really appreciate light work, right? So the fact that we are touching and communicating and willing to have an equal shareholder in our patient, I think it can be a motivator as well as a efficacy builder. I want to go back for 1 second because you said something earlier about the style of work we do, and this paper kind of irritates people sometimes, but I kind of like that. There's a paper that was done in 2011, and we'll link this in your show notes here. I think it was 2011, but it's basically they were comparing two types of massage for chronic low back pain. One was very specific medical clinical massage for low back pain from whatever framework that they came in that study. And the second was relaxation massage. And what they looked at was 6-month long-term outcomes. And what they found is across the board, outcomes were about the same, which is really irritating to some people because relaxation massage isn't specific, right? It's like it's not serious stuff. But that's how you and I have been sold this stuff. No, if you want to get to the root of an orthopedic or neurologic problem, you need to take this training to learn this very specific model, which, you know what, sometimes that gives us good outcomes. But to say that we have better outcomes than anybody else, just because somebody walked in our door and said, you know what, I tried this other person, they didn't help me, and you help them, therefore you feel like, well, my work is more effective than that work. But that's like going back to the philosophy of causation. It's so complex to say why one intervention worked and one didn't. Okay. But when you look at some of studies like this, and there's a few others out there like that compare two different styles and show that basically they're having the same sort of short and long-term output or outcome, which challenges us, which pisses us off because it's like, no, I paid money to be a master clinician. And you're telling me that person doing relaxation massage may have the same effect. May. I didn't say can, right? Or will, but may. And I think that goes back to, I think it's a part of the relationship that we build versus the magic we think we're doing with our hands or to their tissues.
Teaching on camera as much as I do, I'm running 4 cameras in my studio, like flipping live when I do trainings with Kristen or anybody else. So when Kristen works on me, this happens all the time. I like big, broad, deep pressure sometimes. But in my experience, it's broad. So I use my feet, legs, knees, like different tools than maybe some therapists are familiar with. And when Kristen works on me all the time, I'm like, ooh, can you back off just a little bit? And then she realizes she can eventually, be standing on me or using pretty broad pressure, but I have to kind of build up to that. And then we have these conversations about suspension, which is like, so you can basically have some support so you can push against it, a decreased pressure if you're doing like double-footed compressions, things like that. And she really likes, deep compression as well. But there's this ongoing process of communication back and forth. And I think what's also instructive is some days it's different. Some days I can't take the deep pressure. Some days a little lighter pressure with a different, like a forearm or a different tool works better. And it's so variable because I'm the guy, right? Like I'm the teacher, But my body on some days just seems to respond differently for different reasons. That's where there's a certain softness. Like I can use deep pressure, and I love giving therapists what I always tell them. I'm giving them more tools, just a broader tool set. When you work on a mat and you can do kind of a joint mobilization with compression with your feet or whatever, I'm just broadening your tool set. The students are often quite taken aback to realize that I can put somebody in a static hold on a mat that's more akin to something like craniosacral therapy than it is what they think I'm teaching, which is these extremely deep compressions.
Right.
And then when they go, well, how did you know to, and I go, I just communicate with the client and base the pressure, the tools on various things. What do I think in that moment is going to be most effective for the client and what's easiest on my body? The more I did that, even my own community of Thai massage teachers were like, that's not traditional. And I live in Central Texas, man. Like none of this is traditional to Texas. Like I just help people. The clients love it. The therapists then say, I don't understand. This isn't massage. And I'm like, like, I'm trying to help people get better here. Like, I learned how, and this is a conversation recently, I've had this one as well, relaxation. People would have conversations because I tend, in my practice, to focus on pain management and mobility. I'm not as focused on relaxation, but it's not that my work isn't relaxing. If anything, I would ask Kristen or other students, you know, what do you find more? And they're like, dude, I hate going to get table work. And I'm like, okay, why? And they're like, I just don't, it's annoying. Like it doesn't help me with my stuff. And I'm like, okay, so you find what we're doing on a mat to be more relaxing. And they're like, yeah. And I'm like, why don't I market for relaxation? And this is that communication thing expanded to the level of marketing and advertising.
Right.
There's a whole industry of massage therapists selling relaxation. If people's conception of relaxation is being on a table naked underneath sheets and oil and softened lighting and candles, that's not really what I offer. So it's like, okay, I think it's a better use of my time to communicate with the clients and help them with chronic pain stuff that I might be a little bit more skilled at being able to help people with. As my practice gravitated that way, it wasn't that I thought the work was less relaxing. It was just, it wasn't a good marketing shtick for me to try to grab people's attention. What I could say is, listen, if you have a problem with some sort of pain management or mobility, you feel stiff, tight, you're coding at a keyboard and you have a tight neck, I'd love to be able to work with you and help you with chronic pain. That's what I have experience with, and that's what I enjoy working on. I also got clients who, instead of, and I see this a lot with therapists, they want to be, sometimes it feels like, service providers instead of problem solvers.
Right.
And when
Which
I say
is service, service providers, basically you're doing what the client or the patient tells you to, which is fine, right? I mean, I don't have a problem with that. In fact, people are willing to pay really good money for that. So you'd be a fool not to at least consider that. But I think there's a difference between, actually, I think there should be somewhere in the middle. The client needs to have input. It's not like a them or us. They tell us what to do, or we tell them what's necessary, right? Can't you find a place in between? That's just my opinion on all that.
Yeah.
But,
I mean,
and relaxation to me, and I think I'm going where you're going here. I don't see the wall between relaxation work and call it what you want, clinical work, because should we not be allowing or encouraging or swaying our patient into a parasympathetic response to what we're doing? Because does parasympathetic activation cause other cyclical things to occur that can benefit pain, benefit from movement, benefit from all the things that are medically related patients are coming in for? Somehow that thought that relaxation is just fluff and buff is just absurd. All right. In some ways, maybe relaxation is one of the common denominators that we're giving our patients, because, Robert, if you're seeking deep pressure, and if I am touching you with that nickel of pressure of craniosacral therapy, I might be just irritating the crap out of you, raising your sympathetic response in terms of fight or flight type stuff and just agitation. And it may not be relaxing for you at all, even though I think this is what's best for Robert. I think we need to just have more communication and understand that relaxation is a lot more than just tuning out for an hour. Relaxation is allowing the body go into that parasympathetic state where a lot of both motor learning principles are possible, as well as changes from top down can happen, and where a more neurocentric and behavior-based approach can really kick in. I think the two are a lot more enmeshed, relaxation and clinical work, a lot more enmeshed than really people want to believe.